This is a plain and contrast enhanced CT scan of face of a 15 years old male patient. The patient presented with epistaxis and nasal obstruction. There is a large mass in the nasopharynx, eroding adjacent bones and extending downwards. This is plain scan. Now I will show you his contrast NAN CT scan. This is contrast NAN CT scan. This is the mass lesion here, which is extending upwards to involve the sphenoidal sinus. In this region, it has eroded right lateral wall of the sphenoidal sinus and shows extension into medial part of the middle cranial fossa. However, it remains extradural in location. It has indented medial side of the right temporal lobe. As I scroll it down, the mass extends downwards and extends across the midline onto left side as well. The mass has given rise to right automastoiditis because it has obstructed right eustachian tube. Anteriorly, the mass extends into the nasal cavity. Superiorly, the mass has eroded right greater wing of sphenoid. This is the mass lesion. I will show you further details in the coronal scan. Now the mass has eroded and indented posterior and medial walls of the right maxillary sinus. Now this is the left pterygoid bone and its medial and lateral pterygoid plates. On right side, the mass has eroded right pterygoid bone, both of its plates, extends into right infratemporal fossa. This is the coronal scan. The mass has eroded. Now this is the anterior most part of the right inferior turbinate, right middle turbinate. The rest of the right inferior and middle turbinates are eroded. Now this is the medial wall of right maxillary sinus. It is eroded and displaced laterally. Right maxillary sinus is opacified. As I scroll it, posteriorly the mass has eroded internasal septum and extends across the midline onto left side and has eroded left inferior and middle turbinates. Now please observe here that the mass has eroded floor of right ethmoidal sinus. Now this is the region of the inferior oblique fissure. This is the inferior oblique fissure on left side. The mass has eroded inferior oblique fissure, extends into the ethmoidal sinus. Cribriform plate is intact. There is no intracranial extension in this region. There is no intraorbital extension either. Now in this region, the mass has eroded antero-inferior walls of the right sphenoidal sinus and extends into right sphenoidal sinus. In this region, it has eroded right lateral wall and there is extension into medial part of the right middle cranial fossa. Now this is the septum or partition between both the sphenoidal sinuses. It is displaced and eroded. There is mild extension of the mass into the medial part of left sphenoidal sinus as well in this region. Now please observe inferiorly that the mass has eroded hard palate, which is displaced downwards. This is the region of the infratemporal fossa and nasopharynx. axial scan. The mass has involved the carotid sheath. Now this is the internal carotid artery. At the base of skull, it is surrounded by the mass here. This is internal jugular vein. Now please see, this is the left internal carotid artery and left internal jugular vein. Internal jugular vein is spared, however its lumen is slightly narrowed. The mass has infiltrated medial and lateral pterygoid muscles. Now this is the pterygomaxillary fission and pterygopalatine fossa on left side. While all this region is occupied and the adjacent bones, these are all eroded by the mass. The mass shows marked non-homogeneous enhancement. Its blood supplies from the external carotid artery and ascending pharyngeal artery. Now please see this anteriorly displaced, thinned and eroded posterior wall of right maxillary sinus. As I scroll it medially, inferior wall of right sphenoidal sinus and anterior wall of right sphenoidal sinus is eroded and mass extends into it. There is no involvement of pituitary fossa or intracranial extension at this level. Please observe this eroded and downwardsly displaced hard palate here. Posteriorly, the mass has involved right longus capitis muscle as well. These are the bone details. Since the mass has involved right eustachian tube, please observe right otomastoiditis, soft tissue attenuation medium in all the right mastoid ear cells and middle ear cavity. These are the middle ear ossicles here. Eroded right side of greater wing of sphenoid. This is the region of the sphenoidal sinuses. Eroded right lateral wall of sphenoidal sinus. Extension into the nasal cavity. Now please observe, this is the pterygoid bone on left side, medial and lateral pterygoid plates, while all this complex is eroded on right side. So it's a case of juvenile nasopharyngeal angiofibroma, very extensive bone details in the coronal scan. Please observe the eroded hard palate.